Welcome to the Stratus Health Class Toolkit Quickinar 2 covering mindsets. Section 1 of the toolkit describes 4 mindsets that are key to providing care and services that are culturally appropriate. This Quickinar will cover those 4 mindsets and a bit about each one. The 4 mindsets are Mindset 1, seek collaboration. Mindset 2, practice self-awareness. Mindset 3, build relational trust. Mindset 4, take action to learn. These 4 mindsets are informed by the liberatory design, which is a practice of centering equity in design efforts. The toolkit has short descriptions of 4 mindsets, followed by many case studies detailing how you can put those mindsets into practice. Seeking collaboration is all about designing with your patients or clients, not for them. Seek to collaborate as you think about how your organization can apply or better apply the CLAS standards. Often, old ideas of power and authority can get in the way of meaningful change. CLAS is about offering care and services that respect a diversity of cultures and languages. Invite individuals with diverse identities, roles, and skills to help design your organization's CLAS efforts. When you invite those individuals in, design conversations feel a sense of belonging. If you are unsure how to do that, you might ask them how you can better support their full participation. Build time for them to get to know each other in your organization. Have an icebreaker or warm-up question at each meeting that gets people telling stories about the values that bring them to the work. Imagine possibilities together. Ask questions that begin with, "How might we?" The goal is to work together to better serve all cultures and languages. You need people with different perspectives to do that well. The second mindset is practicing self-awareness. Very simply put, our beliefs impact our practices. We all have values, beliefs, and biases that we may not even be aware of. When working to provide care and services that are responsive to the needs of diverse individuals, knowing those values, beliefs, and biases is important and essential. You can't design equitable services if your process for creating those services is inequitable. Put another way, your process must be equitable if you want equitable outcomes. Good intentions alone won't do it. You might begin by considering why you are doing this work. Why is respecting and responding to someone's culture and language important to you? What identities do you bring to your work? How might those things impact what you are trying to do? Many resources are out there to help you become more self-aware. There are implicit bias quizzes, books, discussion groups, podcasts, and trainings that can help you guide you in your reflections. The third mindset is about building relational trust. Imagine for a minute the people in your life that make you feel most valued. If I asked you to describe why they make you feel valued, what they do to show you they value you, you might say things like, they listen to you, they are interested in you, they don't push their opinions or answers on you, or that there's give and take to the relationship. It's not all about them. Building relational trust is all about making people feel valued in their relationship with you, making sure they don't feel like an afterthought, but central to the work. Like meetings and conversations were designed for them, not your organization. If you're going to find ways to provide care and services that value your patients and clients, you need the honest input and partnership of others. And to get that, you must make sure they feel valued and safe to share that input. That is what relational trust is all about. The last mindset is take action to learn. Often in working to ensure culturally appropriate and respectful care, it's not uncommon to worry about messing something up, getting stuck along the way, or worrying about what others will think of the changes you enact. This mindset is so important because you won't have all the answers and may face resistance to change in your organization. Taking action to learn emphasizes learning and better understanding something, which is much less threatening and has lower impact than big-scale change. For example, if your organization announced, we are going to start requiring care providers to collect client demographic data as part of visits, there might be some pushback, maybe lots of questions and people unsure about what it would mean for them. If, however, your organization said, we want to start collecting client demographic data, as a first step, we'll be talking with each of you to understand what you think is important in doing that and what supports you need to do that well. That's a lot less threatening and less likely to be opposed. Some ways you can take action to learn are to start by getting answers to learning questions, things you want to find out to help you design a better solution. Design small experiments. Try something as a 1 month or 3 month pilot, or implementing something with a segment of the organization. Debrief what happens and build on your learnings. Identify what's important in an experiment or solution. What values or principles are needed to guide the work. Then design something that aligns with your agreements. While there are other mindsets important to equitable care, these 4 mindsets should get you off to a good start. Share them with CLAS organization or organizational leaders and discuss how you want to bring them to life in your organization.